Emotions can often come up when you're getting manual therapy for your head, neck, or jaw pain. Let's talk about it. I'm Katie, a massage therapist, and I love talking about self-relief for the muscular side of head, neck, and jaw pain so much that I've created online video courses so that you can learn from home. In this video, I'm offering a little advice and maybe a little comfort if you've ever had emotions coming up while you've been receiving manual therapy for your head, neck, or jaw pain. This is even better to hear before you've gone in for therapy in case you have a little hesitation. You might have developed your neck or jaw pain from accidents, injuries, or even trauma. It could be physical or emotional. The physical could be totally accidental, like a fall in a ski slope or a car crash. It could be a surgery, or it could have even been from physical abuse. The emotional reasons we could hold pain in this area could come from large or small events at any age, and then also how much we've internalized them through the years. Being told to shut the fudge up and to swallow your emotions. And because we're complex living people that experience so much in our lives from all of these categories, they can sometimes feed on each other. If you've decided to get manual therapy for your headaches, neck or jaw pain, movement, dysfunction of the jaw, you're probably going to a licensed massage therapist or a physical therapist. Some of those feelings can sometimes come up from the physical or emotional trauma. I think the best physical healing can only happen when you feel safe. So let's talk about how to make that happen for you. I have seen people who have neglected care in some of these areas where there has been so much trauma. This could be dental care or even face or hair care. Kind touch therapy can help to bridge that. Remember, working with a manual therapist does not replace working with a professional talk therapist. Those are often needed for some of you to process that work at a real deeper level. One way to feel safe in a session is to feel empowered. Speak up and ask for what you need or what adjustments could be made for you to feel more comfortable. It could be as simple as a blanket or a table warmer turned on if that's available. Talk to the therapist about the changes you need with pressure as well. This really is your body and your session. My session is when I go to the table for work. It could be that you need a pause from the work so you can process the work, ask questions, give feedback on helpful or even not helpful techniques. A little different from a pause is a stop. It could mean stop altogether. We are done for the day. It could be stop working on the jaw now, but I'm okay with more shoulder work today. You don't have to know why you need a pause or why you need to stop. You actually don't have to fully explain that to your therapist. Just be very clear in how you need us to react and adjust for the session. Know that when you come to the table, you don't have to get all the muscles treated on the first, the second, or the ever session even. Communicate to the therapist on your no-touch now zones. Maybe that list could change in the future, but only with your agreement. I really encourage you to stay in the present moment when you're in a session. Don't drift away to the past or the future. Those are places where fear and anxiety can live. So to do that, really feel the table supporting you and holding you. Find comfort there. Feel your breath calmly entering your body, nourishing you, and calmly leaving your body. Try to identify what feels useful, helpful, and connected in that session so that you and your therapist can explore that connection. Know that many emotions, including anger or confusion, comes up. I've heard this phrase, "Why the fudge didn't anybody tell me my muscles were the issue? Why didn't they tell me it was so simple to address?" And I've also heard, I didn't connect that the scar tissue from the emergency tracheotomy I had as a kid could be giving me this throat tension. If you're receiving work and during the session or after the session, these big emotional heavy things come up and you're not in a place to physically to process them emotionally even, or if you're not near your safe people, try this. Put those emotions in a little container and put a lid on them. Be sure to take them with you. Only open it up to process it when you're in your safe place with your trusted circle of a therapist or a trusted family member at an appropriate time. Not in a grocery store or a busy waiting room, and definitely not on your drive down the highway home. As you address both the emotional and the physical sides of your head, neck, and jaw pain, you're going to make progress. It will also benefit your body and mind to continue doing self-relief from home. Your therapist might show you self-massage or stretching you can do. When you're doing those, show yourself some kindness and self-compassion when you do that work. If you'd like to learn from me at home so that you can feel more confident and empowered walking into a manual therapy office to get that work, check out my online video course, Help Head Pain. I've got video courses there, and there's a free video lesson that you can start with as well.